One of the interesting things about the traveling population today is they're getting older and they're getting sicker. And they're older and sicker and traveling. So what that means is people will go online to Orbitz or whatever type of online. They'll book their trip and off they go to Kilimanjaro or off they go to India. And they may have multiple medications, multiple disease states. So as a pharmacist, travel health provider, you're going to see now a complexity of patients that maybe we didn't see in the past, because that person with COPD is not flying abroad, but now they are, because it's a lot easier to travel now. The medications for different diseases may be more effective, but it brings in a new level of complexity. So as a travel health provider, you need to think about the pre-positioning of medications, the possibility of acquiring abroad, and what are some of the challenges inherent in that. The first thing is preparing your traveler. So let's say you have a traveler who's on multiple medications. What a lot of travelers like to do, and not even travelers, just patients at home, what they like to do is they use the little Monday, Tuesday, Wednesday, Thursday little box, med box. Pill boxes are great. They keep people on track. They put all their meds in there. It's a great compliance tool. However, traveling abroad, little white tablets in little containers going through airport screeners at customs is not always the best thing, right? So customs agents are not pharmacists. They don't know what that drug is. To them, everything looks like a narcotic. So they're going to be suspicious of all your medications. What's the worst case scenario? They confiscate your medication. There might even be more worst case scenarios. If you're flying into the Middle East, you're going to Abu Dhabi, you're going somewhere where controlled substances are not only illegal to bring in, you might be confiscated yourself at the airport if you're trying to bring in your pain medication, for example, without knowing that that's a banned drug for that country. So understanding first and preparing that traveler for what they're going to experience is the first thing. Next, you could have them, if you're not going to put it in a little tablet box, how do you take your medications? We always recommend that they bring everything in the originally labeled container. So if that's in the prescription vial, that it has the label on there, it's got their name, the physician, the directions. Here's what customs agents are looking for. Are you bringing in an excessive supply of medication that you might be selling in our country? You are bringing in unregistered drugs, right? So that Lipitor or whatever you're bringing from the United States is not registered in the country you're going into. It's like United States people buying Canadian drugs that are not registered and approved by the FDA here, right? Not legal. So in other countries, they're giving you that privilege to bring your medication in. What you need to prove to them is it's for you, right? And only for you. So not bringing in excessive supplies. Birth control sometimes is a problem because pharmacists like to label the whole box or the package and it's got 3 months worth in there. And now when they take it apart, it doesn't have a label on it anymore. Inhalers are another problem. Take the inhaler out of the box and now there's no label on the inhaler. So make sure we tell patients to tell their pharmacist, and you as the pharmacist providing this service, make sure you instruct them, keep it in the box, or I'm going to label the canister, or I'm going to label your actual birth control pack itself, so that worst case scenario, you don't get it confiscated. Right? Let's say they make it into the country with their medications, but now they lose it. Or their trip lasts longer than they thought, and now they didn't bring enough medication with them. What are your options? It turns out that it's illegal to mail medications internationally. So let's say you're in some country and you call home and you ask your brother, your aunt, your uncle, whoever, to mail you some of your medication, right? That's not legal. The only people who can do that are wholesalers, manufacturers, right? They can move drug around, right? But you as a personal citizen cannot. So two ends. One, the US may confiscate it before it goes, because you're not allowed to mail medications. If they mess it, when it comes into the country at your destination, customs agents there might also, right, confiscate it. So that's a dicey proposition. Maybe it gets through, if you're lucky it gets through, but if you're not, they confiscate it and you're out the money that you spent on that medication, and you don't have your medication. Your other option, try to acquire a meds abroad. Right? In different countries, there are different laws, meaning that you can walk into a pharmacy in some Southeast Asian countries and prescription over the counter is irrelevant. Whatever they have, they're going to give you. They can give you antibiotics and anything else. The problem, however, is that the same level of security and safety of the drug supply system, or the pedigree within the United States that we have, is not present in developing countries. So all along the way, from the manufacturer to the outlet at the community pharmacy, it can be tampered with. So counterfeit medications throughout the world is a major problem. Some places in Africa have upwards of 30 to 70% of certain types of medications are counterfeit. Right? If you're lucky, you get lactose. Right? That's if you're lucky. If you're unlucky, you get a whole different drug that was used to counterfeit your medication, which may be very dangerous to you. So we recommend patients never try to acquire medications abroad. Right? Your main strategy is get it before you go. Right? If you have to, you've run out of medication, your medication got stolen, you can't ship it in, you've tried everything else, then you might have to acquire medication abroad. Now you want to think about where to get it. Usually the best place within developing countries is a hospital-based pharmacy. So if you can go to a hospital and they have an outpatient area, you're more likely to get medication that's unadulterated than in a community pharmacy somewhere. Just so happens that in the hospital, they usually have more direct manufacture to hospital and less people in the middle that may tamper with the medication along the way. It's not an absolute, but it's a strategy that people might use. Also, look at that tablet. When it comes out, call your pharmacist back home. Say, I've got this thing. There are international databases that pharmacists have access to. They can look at that imprint code. Yeah, you can take, now everyone takes a picture on their phone. Right? Just take a picture of it, you send it to the pharmacist, they look it up and say, nope, that's not the right imprint code for what's on that box. You might have an adulterated medication. So there are things that your pharmacist can do for you at home to help you make sure that, or at least to get along the way of making sure that the medication you just acquired is safe and may do what you want. And then also consider that maybe you should just go to a clinic, get re-diagnosed, and then prescribed by that physician something that's available in the country. Because you're also faced with the issue of, I'm taking my metformin here in the United States for diabetes, but in India it's not available. There's nothing called metformin there. So now what do I do? Now you're either trying to get the pharmacist to figure out an equivalent product there. You might be better off just going into a clinic and having them prescribe something for you right then that you can use. Other options are you can go home. If you have such a narrow therapeutic index, let's say it's Coumadin that you're on, and you can't find a product like that, or it's insulin and you can't find a product like that, and you have to use something in the short term, it may be safer for you just to get back to the United States.